On December 15, 2022, an important bill passed out of the Senate Health Committee. Votes were unanimous in support of Bill S1522, which eliminates practice restrictions for advanced practice nurses, otherwise known as nurse practitioners. These restrictions impact access to care in New Jersey in all health fields. This Mythbusters podcast is developed to eliminate the myths and to share the truth about nurse practitioner practice in New Jersey.
For today's podcast, I would like to welcome Dr. Varsha Singh. Dr. Singh is a Jonas Scholar, and she is currently the Stroke Program Manager at St. Joseph's University Medical Center. In addition, she's part-time faculty for the Family Nurse Practitioner Program at Fairleigh Dickinson University. She has served and held multiple leadership positions in nursing and has been participating in multiple nursing organizations, which include the Indian Nurse Practitioner Association and the New Jersey State Nursing Association. In addition, she is the AANP, American Association of Nurse Practitioners State Liaison. Welcome, Dr. Singh.
So what is the difference between an APRN, an APN, an NP, an MD, or a PA? There's a lot of these titles. Would you be able to explain the differences?
Of course, Marcel. Nearly every healthcare profession has its own unique language, and then they have a lot of alphabets behind the name. So it's really evident that the patients may have confusion who are physicians. So physicians, or the medical doctors, as we say, they are either MD or with a DO degree, and they are highly trained in medical profession, which they have graduated from a medical school. Basically, they go through a residency program, fellowship, and they can treat patients, they prescribe medication. So in our general terminology, we refer to them as medical doctors, right? MD or DO. Now, when we are looking at the physician assistants, or now they are going for the terminology of, I think, physician associates. So not necessarily they come from a medical background, but they go through a 27-month master's degree program, which includes a combination of classroom, clinical rotation, and various specialty. And then when they graduate, basically they work under the umbrella of physician, and whichever specialty they are going to train for, and they continue to be in that particular specialty, such as a physician assistant in a surgery or OBGYN. So once they're certified, they can do exactly the same thing. They can diagnose, they can develop and manage treatment plan along with the collaboration with the physician. And they work with at least one supervising physician. They have to. While now when we talk about the nurse practitioner, so nurse practitioners are nurses with advanced degree. We call them advanced practice registered nurse with a master's or a doctoral program in nursing. So in order to become nurse practitioner, they must be a registered nurse, and they have to go through 4 years of rigorous training. Includes extensive clinical expertise, and once they graduate, they have to pass their board exam, which is a national board exam, and then they can apply for their license. They are credentialed, licensed, advanced practice nurses, and what they can do, they can perform assessment for the patient, diagnose, order labs, prepare a comprehensive plan of care, which includes preventative services as well as prescription of treatments. They can order tests, they can follow patients, they can order preventative medicine. So if you look at all three roles, and if you just want to put together, regardless of the titles, the functions that they perform, they are all at the same level: assessment, diagnosing, ordering, and interpreting the results, and then continue to monitor the patient for their preventative health. So I wanted to ask you, did I explain it correctly?
Yes, thank you. That was very, very helpful. So what is the term FP, or full practice authority? Like, what is the difference then? Why are we trying to pass a legislation that is full practice? What does that mean?
Okay, so when we are looking at full practice authority, we are simply talking about barrier-free nurse practitioner practice. Now, when we talk about what is barrier-free, so it's the ability to practice according to the advanced practice scope of practice without the need of the joint protocol with the physician. So right now, I believe that those states where they have limited or the reduced practice, the nurse practitioners must have a joint protocol with a physician, minimum one physician. So full practice authority is the authorization of nurse practitioners who are advanced practice nurses to perform their essential functions. Here I'm talking about the basic essential functions for which they have gone to that advanced degree program in the university. So it's such as timely assessment of patients, diagnose, order, interpret, diagnostic test, initiate and manage treatment. So when we talk about full practice authority in FPA status, like FPA is a very familiar terminology within the nurse practitioner community. The nurse practitioner licensure is not contingent on unnecessary contracts or relationship with a supervising or a physician or oversight by the state medical board. So as a result, we understand that under full practice authority status, nurse practitioners are more likely to practice in those underserved areas and take care of vulnerable and needy population who do not have access to healthcare. And that is the reason we are really looking at our advanced practice nurses achieving the full practice authority.
Thank you. So it would improve access to care and remove restrictions that require contractual physician agreement.
Absolutely. And it is, I think it's a teamwork, and we want to make sure that every team member who's providing care to our patients, they work at their fullest potential.